Okay, I'll start sharing my screen. Fine. I'll join now. Okay. And ICD 10. Okay, so chapter number 1, any doubt? Any doubt on chapter number 1?
Sir?
Yes?
Because there is lot of codes in chapter number 1. Like for other questions, they will ask us like direct names.
Sorry, I didn't get you. Lots of codes. Which question?
Codes are there. It can be anything. Like for example, like Brazilian purpuric fever, like A48.8. Like they will ask us a direct question.
That's correct. See, ICD, it will be direct question only. Because if I'll ask you here, what is the code for fever? Okay, you will find a code for fever, you will get the answer. But the thing is, that is a normal practice, what we do in a offices, right? In our work. Direct answers. I am teaching you? If it is a very direct, then it should not be a class, right? Why I am teaching you? Because we have certain guidelines which you need to remember. If I say I have a fever and I have a COVID, or I have a dengue, then you'll feel, yeah, fever we have a separate code, dengue fever we have a separate code. I think as per the general guideline, when more specific codes are there, I have to go there, right? How do I know? How do you know that? Because you read the guideline. Similarly, if I say I have a leg pain, I have arthritis, you will see here two conditions, right? If no one knows, if someone do not know guideline, they will say code both. But then you read a guideline, you will know that no, we have arthritis, we have a pain on the same location. So as per the guideline, you have to code the diagnosis, not symptoms, right? This is the only thing which we are going to discuss, which we are discussing as of now.
As of now, okay.
Right now?
Yes.
It's a guideline, that's all. Otherwise, the codes are very simple. It's not like a CPD where I have to describe you what is a procedure, what is a thing, what is that thing, this thing, right? It's not like a CPD. It's a very simple one. The only thing we need to remember guideline. That's all. Like in a HIV guideline, we have a HIV. We have a condition. HIV related condition. Okay. Now, how do I know which one I have to code first, which we have to code second, as per the guideline? Done. Correct? So, in a chapter number 1, we discuss about the HIV, AIDS, sepsis, severe sepsis, MRSA, MSSA, and what else? COVID.
Zika virus and COVID.
Zika virus and COVID. All good on that? Tomorrow I'll come class, okay? If someone will feel okay, why this online class today? I was not feeling well, so I decided not to spread my infection to others. That is why today was an online class. Okay, can we start directly say chapter number 2 now? Good to go?
Yes, sir.
Okay.
Yes.
So in chapter number 2, what we are going to see? So that's chapter number 4. This is fine. I will not maximize. I feel that I hope this is good. So in chapter number 2, it's a C and D series. Not all D series are covered under chapter 2. Some are chapter number 3 also related to bloods. Okay. So all C conditions, C series codes are and few D are cancerous. Okay. Now what is cancer? You can see this diagram. Normal cell versus cancerous cell. Cancerous cells are abnormal. Okay. Rapid multiplications will happen over there in a cancerous cell. That is why you can see outgrowth. Cancer cells are abnormal cells which have a potential to migrate to some other places also. Okay, this is a basic morphological difference of the cancer cells and normal cells. Large cystocele, small cystocele, single nucleus, multiple nucleus, single nucleus, multiple large nucleoli, fine chromatin, coarse chromatin. Okay, these are the cancer. Now for cancer, you will find in your volume 2. Volume 2 refers to first part of your book after alphabet index. If you want to search any code from alphabet index for any cancer, if I say cancer of a thyroid, so if you go to cancer, it will say C neoplasm. So once you will go to the neoplasm it will tell you to see or to check table of neoplasm. This table which you will find after your alphabet index. So in that only we have a sixth thing: malignant primary, malignant secondary, benign, cancer in situ, of uncertain behavior and of unspecified nature. Okay. So for each location, each body part, you will get 6 code of a cancer. Because this is that code belongs to the nature of a cancer. Whether it's a malignant primary or malignant secondary or benign, cancer in situ, uncertain behavior or unspecified nature. Fine. What is the difference between benign and malignant? You can see here. Tumor is non-cancerous and does not have a ability to spread. That is a benign. But there is a tumor. Okay. Malignant tumor is a cancerous and has the ability to spread in situ. In situ is tumor does not have ability to spread but can be cancerous or non-cancerous. And uncertain, the behavior of the tumor was not able to determine. Unspecified, they are not telling whether it's a benign or malignant or what. Okay. So you can see this benign tumor. In situ, you can see that all the cancerous cells are in a one capsular structure. Means it is not migrating to any other place. It will be there only. Okay, that is cancer in situ. But malignant is the most dangerous thing because that can spread any part of our body. Like patient has a thyroid cancer, if they will not get proper treatment for a cancer, that cancer and a restriction of the cancer, it can go to the other part of a neck, other part of a chest, other part of abdomen, other part of a even toes also. So see the cancerous cell from the neck, it can travel to patient's toes. That is the most dangerous thing about the cancer. Okay, the metastasis.
Sir?
Yeah.
So this benign can be transformed into malignant. Is it that will happen, sir?
Definitely it happens. It can be, so benign is the initial part, right? So definitely the patient will not get treated because see, our Cancer Society of India, why they have, they do some awareness campaign, especially for the women's breast cancer. Because here, not most major population are not aware about the cancer. They will never believe that they can have a cancer. Right? People even consuming tobacco also, they will say, no, yaar, this is not for me. Yaar. Cancer, it will never happen to me. Right? I am a very healthy person. Still, if the patient is smoking, is a chain smoker, they will not believe that it can cause cancer. Right? So if they will get a small lump, they will say, no, this is not a cancer. This is just small lump. And they will resect it. That's all. That is why here in India, cancer was diagnosed in a very advanced stage. Correct? If for most of you, radiology has been done, except 11th batch, 11th or 10th batch, 10th batch. So you remember we have a screening mammography code there, screening and diagnostic mammography code in a radiology. Their patient has to, if the patient have a history of a cancer, okay, or patient have a personal or family history of a cancer, then that lady has to visit every year to the mammography center for the screening method, screening procedure. Although she did not develop any symptom of a cancer, still she has to go for every year annual checkup of a breast cancer. That was they are advanced, right? They have more awareness than us. So it definitely benign can, if benign cannot be treated well, benign cannot be diagnosed in advanced stage, it can lead to the malignant. Similar way for the in situ also. Okay, that is an initial stage or the specificity of a cancer in situ, but it have a chance to go to develop to progress to the malignant. Okay. So for cancer, if you are getting any suffix oma, okay, carcinoma, adenoma, lymphoma, this all are a cancer only. Primary site versus secondary site. So suppose if I'll say patient had a liver cancer, and now it has reached to the lung. So liver cancer would be considered as a primary cancer and lung cancer would be considered as a secondary cancer or metastasis cancer. For cancer, we have certain TNM staging, tumor, nodes, metastasis, TNMs. We have a staging procedure for that. So we'll not go in that as of now. Okay, this is not for exam point of view, this TNM stagings and all. What we need to see the guideline. Okay, let's come to the guideline part. So meanwhile, I'll start highlighting also. Chapter 2, ICD I'm going to suppose the most benign and all malignant neoplasm. Certain benign neoplasms such as prostatic adenomas may be found in the specific body system. Okay, it may be in a, just like a prostate, it will be found in a N series code. Just to remind the record is there. So you have to go as per the how we are going to search it. Okay, primary malignant neoplasm overlapping side boundaries. A primary malignant neoplasm that overlaps two or more contiguous. 1 second, guys. Hello. Ah, sir. Okay, sir. Okay, fine. OTP. Okay, so where we are. Primary malignant neoplasm that overlaps two or more contiguous next to each contiguous sites should be classified to the subcategory overlapping lesions. Okay, so we have a separate code for overlapping lesions also. Unless the combination is specified in elsewhere. If we are getting any combination code, yes, as per the guideline. Remember, see what they are saying, that if you getting a combination code, go with that. Unless combination is specifically indexed elsewhere. It means the same guideline what we have seen in our previous classes, this general guideline, that if we have combo code, go with combo code. If you don't have, code separate, right? So we'll come to the guideline. Admission or encounter for the treatment of a primary site. If the malignant is chiefly responsible for organizing the patient, admission, encounter, and treatment is added to the primary side. Designate the primary malignancy as a principal or first listed code. The only exception of this guideline is admission to the chemotherapy. Exception is for admission of a chemotherapy. What they are saying, patient is coming for patient have a thyroid cancer. Patient is coming for a treatment of thyroid cancer. They did not specify what is the treatment. It may be just a consultation. Okay, so we have to code thyroid cancer, which is a primary site, means malignant primary. Do you remember the table of neoplasm? This one, right? You have to code thyroid malignant primary code as a first listed code. What they are saying exception? Yes, if patient is admitting or patient is coming for chemotherapy. Now the procedure is very clear. Chemotherapy, immunotherapy, radiation therapy, hormonal therapy. Okay, any therapy, then you have to code Z51 series. That is series. Z55.1, Z55.12, 13. We have so many other codes. Okay. Admission and encounter for the secondary site. Okay. So when the patient is admitted because of the primary neoplasm with metastasis and treatment is directed towards the C, this line. Secondary site only. The secondary site neoplasm is designated to a principal diagnosis, even though the primary malignancy is still present. Look at this. It means we have treatment directed codes. Okay, if patient have a thyroid cancer and lung cancer, just imagine patient have a thyroid cancer which is primary and lung cancer is secondary. Now patient is coming for okay, not that one primary. Okay, I'll take example of this one. Okay. Patient is admitted for the treatment of the bone neoplasm which is migrated from the breast. Okay, so C7951 is a bone cancer, primary or secondary? It is secondary. And C50.919 is a code for breast cancer. Okay, now what should be the primary code? It is treatment directed. For which treatment patient is coming? Although patient have both cancer together. Right now, today, 28th of December, patient is coming to hospital. Patient have two cancer, bone cancer and breast cancer both. And the nature of the cancer is breast cancer is the primary, bone cancer is secondary. Now what is the treatment today? Bone cancer. So you have to code C79.51, which is a bone malignant secondary code. Neoplasm of a bone secondary, which will be first listed code, and primary of a breast cancer would be second listed code. Is it good? Check both example. Take both example once. Let me know you have any doubt on this. This is the first guideline. Clear? That the sequencing will be depend on the treatment. We are not changing the nature of a cancer code. Breast cancer is primary, it should be coded, it should be as a primary only. Right? But bone cancer is a secondary in nature. You have to code secondary in nature. But now sequencing will be depend what is the treatment. Metastatic lung cancer, right lower lobe, spread from the liver with the treatment directed to lung. So which is primary, which is secondary here? Can anyone tell me?
Primary is liver and secondary is lung.
Correct. Primary is the liver and secondary is the lung, right? Spread from the liver, no? Okay, now lung is a secondary, liver is a primary. What will be the first listed code now? Sequencing, liver or lung?
Liver.
Liver. No, lung.
Lung.
Treatment directed to the lungs. So lung should be the
Yes. Correct. Lung will be the first. Correct? Clear now? Easy. It's good? Okay. So this was the first guideline. Now, complication of the associated with malignancy. Okay, there are two types of complication. One complication of a therapy, second complication of the cancer. So now in this C section, portion, we are talking about the complication of cancer. Okay, so second. Just a minute. Is it done? Is it not only your head? Just a minute, now. Okay. So there are two types of complication. One is the complication with the cancer. Second, the complication of the treatment. Whatever complication is there, and if the treatment is for complication, okay, treatment is for complication, to resolve complication, you have to quote complication first. Always complication should be coded first, then cancer code. Only one exception we have: anemia. And that too, when anemia is a complication of a cancer, not complication of a therapy. Patient has a breast cancer which has many complications. Complication is because of the cancer, such as anemia and dehydration. Always and always, complication is first, but except anemia. And anemia is also when it is a complication of the cancer. You can see the second part. If I mark it as a A, and this is B. Right? So patient has here we have to code complication first and then cancer, such as the dehydration. Dehydration first and then cancer code. But if the anemia is a complication of the cancer, then anemia should be coded secondary. Cancer should come first. Only exception, this one you can see. Okay, but if the complication is because of a therapy, chemotherapy, radiation therapy, immunotherapy, hormonal therapy, no exception. Even though anemia is a complication of therapy, not complication of a cancer, then anemia should be coded first. Read it. Anemia associated with malignancy when admission gone for malignancy to anemia associated with the malignancy. Okay. And the treatment is only for anemia. Still, we will code malignancy as a principal or first listed code diagnosis followed by the appropriate code of anemia. But if anemia is associated with the chemotherapy, now you can see anemia is now associated with the chemotherapy. You have to code anemia associated with the adverse effect chemotherapy sequence first. See? Suddenly changed. Just because anemia here is associated with the therapy. Chemotherapy, immunotherapy or radiation therapy. Clear? Guys, yes, no?
Yes, sir.
Very good. Now management of a dehydration due to malignancy. Now tell me. Dehydration is a complication of a malignancy. What
Dehydrations first.
Which one?
First dehydration.
Good.
Dehydration and
Dehydration.
Yes, no exception here, right?
mm,
Dehydration sequence first. Same thing here. Okay. Okay, fine. So, treatment of a complication resulting in a surgical procedure. When the admission encounter is for treatment of a complication resulting in surgical procedure, designate the complication as a principal. As I told you, na, always and always. Okay, let me write this one here. Okay. Complication are associated with either cancer or treatment. Fine. So while writing this one, I'm just making sure that you will get the point. Okay. Okay. If the complication here we have to code complication first and cancer code second. Only exception is when anemia is complicated by cancer, where cancer will be first listed code followed by anemia. Done. Okay, this is done. Now the next guideline says, what if the cancer is previously excised? It means cancer is not present. What we can code? We can code Z85 or Z85 category of code, which says personal history of a cancer. When a primary malignancy has been previously excised or eradicated from its site and there is no further treatment directed at the site, and there is no evidence of an existing primary malignancy at that site, you can code Z85 series code, which is for personal history of a cancer code. Okay. Personal history means patient had cancer. Right now, not a single trace available. There's not a single part present in the patient's body. That is Z85. What if patient is coming? Clear this one?
Yes, sir.
Yeah. All present now, only 28 people I can see. Okay. Admission encounter involving chemotherapy, immuno and radiation therapy. So this is not a guideline. We have to go for this step.
Excuse me, sir.
Yes.
In the point number D, it is like in case if the patient is having like completely excised in that particular place. For example, if the patient is having breast cancer and it is completely excised, now the patient is coming for the lung cancer, then
Code lung cancer and code Z85 series for breast cancer. Done.
so first we have to call code lung cancer.
Obviously, because breast cancer, he will not get treatment. It's already treated, right?
But we have to mention breast cancer also.
Definitely, you have to mention.
Okay.
Even though we have a few cancer codes for family history also, like a breast cancer, we have another category of Z series code which says about the family history of a breast cancer. It means patient is susceptible, right? If
Yes.
suppose there are two persons, one person is having both person have a lung cancer. Okay, person A is having lung cancer, coming for treatment. Person B have a lung cancer, coming for treatment. But person B have a history of a breast cancer. Now you just tell me which is a more dangerous. Which person is in a more danger condition?
Person B.
Person B, because he already have or she already had a breast cancer earlier.
Yes.
So now
Yes.
it's a repeated cancer for the patient. It is more complicated, right? That is why we
Yes.
are using this code.
Okay.
Okay, patient admitted encounter for admission for therapy. Okay, patient encounter or admission for therapy. So here we have Z51.0, Z51.11, Z51.12 codes for therapy. Encounter for antineoplastic radiation therapy, encounter for antineoplastic chemotherapy, encounter for antineoplastic immunotherapy. That word, this Z series code, is starting with the encounter word. Remember the first class? If any Z series code is starting with the encounter word, it should be first listed code. Right? So here it will overcome the cancer code. Patient have a lung cancer, patient is coming for treatment of patient is coming for chemotherapy. Code Z51.11 and then lung cancer code. Why it is first listed code? Because it is giving reason for encounter. If a patient admission encounter is for insertion of or implantation of the radioactive element, such as brachytherapy. Okay, so we do not have any code for implantation of something. So you will code malignancy code first because you don't have any code for that. So what we'll code? We'll code cancer code first. If any therapy develops complication, okay, When the patient is admitted for the purpose of external beam radiotherapy, immunotherapy, chemotherapy, and develops complications such as uncontrolled nausea and vomiting or dehydration. The first listed code. Why patient came? Because of the therapy. So you will code first therapy code. Okay. Second, you will code complication code. But suppose it was yesterday. Yesterday, patient came for a therapy and developed dehydration. Today, patient is coming for a dehydration therapy, not cancer therapy. Patient today he is coming for dehydration complication. Then you will code complication first. See, when the patient is admitted, the purpose of insertion of this is an elements of this one. Clear? Patient coming for treatment or therapy and develop complications. Okay. In such case, what happened? Patient code reason for visit first. Which is Z51 series. Clear? If patient is coming for complication, if patient coming with complication for complication treatment, then code complication code first. Done. Good, na? Symptoms, signs, and abnormal finding is chapter number 12, chapter number 18. There we can see if it is related to cancer, no need to code symptom. It is related different symptoms, code it. Disseminated malignant neoplasm is we have a separate code for that. The patient has advanced metastatic disease and no known primary or secondary sites are specified. Malignant neoplasm without specification of a site. This also we have C80.1. They said a patient have a cancer. A patient has a cancer, which part? No, patient have a cancer. Sorry? Which part, boss? No, I don't know. C80.1. Okay. Now sequencing priority. Sequencing of a neoplasm code, which we already know that one. Encounter for the treatment of primary cancer, code primary cancer first, secondary cancer second. Encounter for the treatment of secondary malignancy, code secondary cancer first and primary cancer second. Patient is pregnant, definitely we know the chapter number 15 guideline. You have to code O series code first and then follow the chapter number 2 guideline. Encounter of a complication associated with the neoplasm, complication first, then neoplasm, except anemia. Correct? Complication from the surgical procedure for the treatment of a neoplasm. When an encounter is for the treatment of the complication resulting from a surgical procedure performed for the treatment of the neoplasm. Complication code first, same thing. Complication code first, then neoplasm. Pathological fracture due to neoplasm. Pathological fractures. Patho means disease. So any fracture which is related to disease, not because of injury. If the patient have a bone cancer, then definitely with the small with a small hit or small pressure, small stress also can cause a fracture for those patients. So it will be considered as a pathological fracture. And the patient was just fell down from the bed. By that way, no one will get fracture. But patient got it because he is suffering with the bone cancer. So for that, we have a M84.5 series code. Later on, first you have to code this code, and then you have to code the second code also for cancer.
Sir, for pathologic fracture, any example can you give, sir?
Simple. If the patient have a pathological fracture of a knee or a ankle, and how do I know that is a pathological fracture? Because patient have a bone cancer. So pathological fracture will be caused by 2 or 3 diseases. One is a bone cancer, second is the osteoporosis, third is the osteopenia. Okay, and doctor has to relate it. It's not like patient have a bone cancer, then he will get always and always pathological fracture. He was hit by a car. Definitely is a traumatic fracture. Right? So doctor has to specify that this is a pathological fracture. By that way, you will code M84.5 series code. If it is a what is the traumatic fracture, then it will come to S series code.
Okay, sir.
Current malignancy versus personal history. Current malignancy, we have a series code. Personal history, we have a Z85 series code. Okay. Leukemia, multiple myeloma, and malignant plasma cells. Okay. In this, we have a remission versus personal history. Personal history, again, it will come to Z85 series code. But we have a certain remission code. Remission means it is coming back, right? So if it is clearly documented remission, then you have a separate code for leukemia in remission, multiple myeloma in remission, malignant plasma cells in a remission. You have a separate code for that you will code. Okay?
So remission is a reappearance of the disease, is it, sir?
Correct. Same. Reappearance, coming back. These are the remission. So, but you cannot decide whether it is a remission or not. Okay? Provider or in a question, it should be very clarified that it's a remission. See, if the documentation is unclear here, right? If the documentation is unclear as to whether the leukemia has achieved remission, the provider should be queried. We will ask provider. It means in a real time. In your question, it should be clear. It should be clear. Okay. Malignant neoplasm associated with a transplanted organ. Now patient has undergone with the kidney transplant. I know, last year. Now today he is diagnosed with the kidney cancer. It's not his original kidney. It was a transplanted kidney. So you have to code P86 series code, which is a complication of a transplanted organ, and then cancer code. It means you have to code 2 types of a code. One is a complication code, which is because of which is of a transplanted organ, and then second you will code cancer code. Clear? Breast implant associated with the anaplastic large cell lymphoma, we have a separate code for that, C84.7A. Okay. And C84.7B, we have anaplastic large cell lymphoma, ALK negative in remission. So there is no guideline on the S part. It's just a new code. Okay, it is new code. secondary malignant neoplasm of lymphoma tissues. When a malignant neoplasm of lymphoma tissues metastasize beyond the lymph node, a code from the category C81 to C85 should be final character. Identify extranodal and solid organ site should be assigned rather than a code for the secondary neoplasm. Why? When we are coding this, because it is on the beyond the neoplasm lymph node. That time you will code C81 to C85. Done. Okay. So this is your this cancer part is done. Please take a minute. Okay, let me just show you the slides. If you want. See, if anemia is associated with the adverse effect of the admission of the chemotherapy, what we can do? Anemia first.
Anemia.
Very good. Okay. A patient with a diffuse large B cell lymphoma throughout the lymph nodes is admitted for the chemotherapy and develops uncontrolled nausea and vomiting. No need to open any book, open your book, right?
C is the answer.
Correct. How do you know? We have to go.
Z series Z51. One minute.
Check it. Check this one. In the second scenario, patient is still have pathological fracture, but the treatment is for cancer. Good. Okay, read this. Done? Easy, na? Cancer part. Tell me if you have any doubt or any. All clear? Chapter number 2.
Yes, sir.
Okay, so chapter number 3, we do not have any guideline on chapter number 3. Now come to chapter number 4, okay, which is for endocrine system, endocrine, nutritional and metabolic disease. First thing, what do you mean by endocrine? Glands, we all know, right? Glands are the structure which secrete hormones, chemicals. Okay? There are two types. Everyone have book, no? So you can go and check. Every means in each chapter, beginning of the chapter, you will get 1 or 2 page, which is very very important for your anatomy and medical terminology part. Okay, like if I ask you which of the following does not have, which of the following are not a part of a diagnostic, and endocrine glands, or which of the following is the exocrine gland? You might not be aware about that, but once you will reach there, you will find a list of the endocrine glands. Okay, so endocrine glands are those glands which secrete their secretion hormone directly on the bloodstream. They are also known as ductless glands. There is no duct. And exocrine gland is just opposite. which have ducts. Okay. So in endocrine glands, we will talk mostly about the diabetes mellitus. So diabetes mellitus, diabetes insipidus, both are different. For diabetes insipidus, we have a separate code with no guideline. But diabetes mellitus, we have a many guide. Okay. So diabetes mellitus is of two types. We have two types of diabetes mellitus, type 1 and type 2. Can anyone tell me what is the difference between type 1 and type 2 diabetes mellitus? Anyone?
Congenital and
Age related.
Okay. Anyone else? So what type 1 known as?
type 1 is congenital.
Juvenile diabetes, it is called as.
Correct. It's a juvenile diabetes or IDDM.
Yes,
IDDM means insulin dependent diabetes mellitus.
Diabetes mellitus.
Okay. Insulin dependent diabetes mellitus. Okay. Diabetes is a condition of a high sugar, right? High sugar in our body. Sugar is glucose is a product. If it is in our body, this glucose or sucrose, or glucose or sugar, I would say, it should be metabolized. To metabolize those sugar, we need insulin. So if my body has more sugar, what does it mean? That my insulin is low. Correct. Correct, no? If I have one insulin, one sugar, so they can neutralize each other. My insulin will neutralize to sugar. So my sugar value will be 0. Correct? I'm just giving you a small calculation so that you can understand this one. But suppose I have a 2 sugar, 1 insulin. Then 1 insulin will be attached with 1 sugar, will be neutralized, but 1 sugar is extra. Now my condition is a high sugar. Correct? Okay. So for type 1 diabetes, we need insulin shots, insulin injection. There is no other treatment than insulin. That is type 1 diabetes. Okay. This the age of insulin, the type 1 diabetes is a juvenile. It will be in a very young age, and that is why it is known as a juvenile diabetes also. Okay, juvenile diabetes or IDDM or type 1. It means small kids will have a diabetes. That is why it's a juvenile diabetes. Type 2 is a normal one, normal diabetes. Means what we see patients, right, in our home, in our society. So we have a separate guideline, a separate code for diabetes type 1 and type 2. The guideline will be similar. Okay. Most probably same guideline we have. So let's start with the first thing. Diabetes mellitus codes are combination codes. First thing is the combination. You will get many combination codes here. because diabetes is a disease which can lead to other disease also, right? So like a diabetes retinopathy, diabetes nephropathy, diabetes skin ulcer, diabetes neuropathy. So we have a many combination code. So where we do not need to code two code, we will code a combo code. Like E11.40 is a code for diabetic neuropathy. E11. Nephropathy 29 or 21. Sorry, 21 is a nephropathy code. Okay, so like that we have a combo code. Types of diabetes. The age of the patient is not a sole determining factor. So if your question is saying 10-year-old baby have a diabetes, you will not say this is a diabetes type 1 only. You can't say as per this guideline. The age is not a determining factor. Okay? For the reason, I also refer to juvenile diabetes. You have to code type 2 diabetes in that case. If it is not clearly documented, juvenile diabetes, type 1 diabetes, or IDDM diabetes, you cannot code type 1 diabetes. You have to code type 2 in such case. So age will not be a factor on this. Okay? We got a new code this year for pre-symptomatic type 1 diabetes mellitus. Which patient have type 1 diabetes mellitus, but it is symptoms free or pre-symptomatic. Early stage of a type 1 diabetes mellitus. If the type of a diabetes mellitus is not documented in medical record, by default it should be 11. It means type 2 diabetes mellitus. See, how do you remember type 1 and type 2 code? Is very easy. E10. 10 means 1 plus 0 is equal to 1. So E10 series is for type 1 diabetes mellitus. E11, 1 plus 1 is equal to 2 is for type 2 diabetes mellitus. Easy, na? So by default, if they have not documented type, you have to code type 2 diabetes mellitus. Diabetes mellitus and the use of insulin, oral hypoglycemic drugs, and other injectable non-insulin drugs. You have a code Z79 series code. But it should be long-term use because Z79 series code itself says long-term use of this oral hypoglycemic drugs or insulin or other injectable non-insulin drugs. Insulin will always be injectable.
So long term means more than 1 year.
Long term is not started today. If patient is coming today, he was diagnosed today only diabetes, and doctor wrote a prescription of oral hypoglycemic drugs or anti-diabetic drugs. You can't code Z79 series code because it is just started today. Okay. So if the patient is treated both with the oral hypoglycemic drugs and insulin, both code, you can code that G79.4 and G79.84 should be assigned. The patient treated with the both insulin and injectable, again, both code you can assign. If the patient is treated with both oral hypoglycemic drugs and injectable non-insulin drugs, here also you can code both. Okay. Z79.4 should not be assigned if the insulin is given temporarily to bring a type 2 diabetes type 2 patient blood sugar under control during an encounter. So for that, see this point number 10. Cannot code in the following scenario. When we cannot code Z79.4, when the patient have type 1 diabetes mellitus. So why? Why we can't code? Patient have type 1 diabetes mellitus. Patient is taking insulin from long term. Still we can't code. Why? Anyone? I gave answer already to you.
Because the 79.4 that like those drugs, like, you know, those they are given instant, not for long use.
No, that is a long term. You go to Z79.4. It is a long term use of a insulin drug. Now I'm telling you, patient is taking it long term. Still we can't code. Why? Anyone? What is type 1?
It is juvenile, no sir, engaged.
And also, yeah. Juvenile and
Before reaching puberty.
one more thing I told.
Insulin dependent diabetes mellitus.
Correct. Insulin dependent diabetes mellitus. What does it mean?
It depends on insulin source, so we can't code for
It's not depend. Insulin is this diabetes mellitus is a insulin dependent. It means there is no other treatment. Patient by default he has to take insulin. Okay, there is no other treatment for type 1 diabetes. So when patient is already taking insulin, we know these things, that it is the only treatment, then why we will code additional? Right? Good now? So type 1 diabetes mellitus you cannot code. And gestational diabetes. Gestational diabetes is what? The pregnancy-induced diabetes. That is a temporary diabetes, which is only during pregnancy. Okay, which is only during pregnancy. After pregnancy, it may be most probably it will be resolved. Otherwise, or for few patients, it will lead to type 2 diabetes. Why we cannot code gestational diabetes code? Why we cannot code insulin code along with gestational diabetes? Because there we have a combo code. Okay, and the third one for short term. Good. So always remember that three things: with type 1, with gestational, and for the short period of time. You can't code Z79.4. Okay, next one, diabetes mellitus in pregnancy. That will again come to chapter number 15. Now, complication due to insulin pump malfunction. Now, what happens? Some people need insulin frequently, so and they don't prefer to get injected. Not. So what what we can do? We can insert a insulin pump. That pump will release insulin depends on the requirement. But that is a machine, right? So what happens if it is releasing more or less insulin? If it is releasing more insulin, it will be considered as a insulin toxicity. If it is releasing less insulin, it will be insulin deficient. So underdose of insulin due to insulin pump failure. You will code 3 codes. First code T85.6, which is for mechanical complication of the specified internal or external prosthetic device. Okay. Now, second code is for T38 3XC, 3X6, which will tell you about the what is a complication. First code is not saying any complication. They are saying there is complication, but there is not specifying what is the exact complication. Right? So in the second code, it will be specified that this is a underdosing. And the third code will be your type of insulin code. Fine? Good?
Third is what, sir?
Type of a diabetes code.
Okay.
Whether if it is a type 1, type 2. For type 1, we can code this code. Okay. What if it is an overdose? If it is secreting more insulin? Again, first code is T85.6, which is mechanical complication. But my T85.6 is not describing that what is a complication. So I will code T38.3X1, which is a poisoning code. Now you will feel, why this poisoning, boss? This is insulin only. Yes, this is insulin. But as per the poison, as per the toxicology, in the world, everything is poison. Only depends on a dose. Okay. So here insulin is more. Insulin is higher than required quantity, so it will be considered as a poisoning. Good. And the third code will be same. What is the type of a diabetes? Done. All good? So all these guidelines are good. Yes.
Yes, sir.
Good. This is an easy one, right? Now let's move to secondary diabetes mellitus. We have discussed two types of diabetes mellitus, type 1 and type 2 as of now. Now we have a three more type of diabetes mellitus, which is known as a secondary. Secondary means because of some other disease, other condition. So we have a E08, E09 and E30. E08 is for diabetes mellitus due to underlying condition. Underlying condition means there are four, five condition which is documented, which was proved that can lead diabetes. Okay, so if diabetes is because of that condition, you will code E08 condition. E09 is for chemical and drug induced diabetes. Some, if the diabetes was induced because of any side effect of drugs or chemical, then it's a E09. And if diabetes was induced because of some other thing, not because of underlying condition, not because of a drug or chemical, then it will come to E13 series. Okay, underlying conditions are this one: cystic fibrosis. Okay, I'll show you. I'll show you that. Here I don't have. Series E08. Code for the underlying conditions such as congenital rubella, Cushing syndrome, cystic fibrosis, malignant neoplasm, and malnutrition, along with pancreatitis. Okay, these are the 6 conditions. If inducing diabetes, then you have to code E08. And now, what will be the sequencing? Check it. Check the question. Diabetes due to congenital rubella. E11, E10 or E08? What you will code? The first task is that you need to realize what I have to code: E08, E10 or E11.
E08.
Correct, because this is coming under underlying condition, because this is this diabetes is due to underlying disease, right? Okay. Next, so A and D cancel. Now B or C?
B.
C.
And why? Why also you will tell me, okay?
Because we're coming for diabetics treatment.
Okay. Yes. Okay. Why C? Why not B? Or why B? Why not C?
So B is because first we have to code the underlying condition, that is congenital rubella.
Correct. Okay. That is why. See, code first. So you have to code P35 35.0 is the first condition. Then you have to go to diabetes. Very good. This one. Correct? Because here we have to code condition, then diabetes, and then insulin code also. Insulin, if they have documented under insulin, we can consider it as a long-term use. This one.
D.
Correct. The same thing again here. P35.0 should be the first. And then insulin, the diabetes code is 08.22. 0.22 because the here diabetes is associated, we see, because diabetes was caused because of a congenital rubella. That's true. That is secondary diabetes. But here that diabetes has lead to CKD stage 2. So that is why E08.22 we have to code, and N18.2 also as a code of a CKD stage 2. And then Z79.4. Correct. Easy enough. Okay. So with secondary diabetes, you can code that 79.4 or 79.84 or 85. Okay. Secondary diabetes due to pancreatectomy. Now, for this we do not. Tell me, for pancreatectomy, pancreas removal, is it underlying condition? Is it underlying condition? Patient, see why? Pancreas is an organ which secrete insulin. If surgically they have removed pancreas, that is known as a pancreatectomy, removal of a pancreas. If pancreas has been removed, then definitely patient will suffer with the diabetes mellitus. Okay. Now tell me which series you will code. E08 you will code, or E09 or E13.
E13.
E08 is an underlying condition. We don't have underlying condition, right? E09 we have
Is for drugs and
because of
chemicals.
drug and chemical. Pancreatectomy is not a drug and chemical. So yes, E13 will be correct answer. It's correct. Okay. So let's come to this part. So see, if the patient is suffering diabetes because of a pancreatectomy, so what we have to code for post pancreatectomy diabetes mellitus, lack of insulin due to the surgical removal of all parts of pancreas, assign E89.1 first list, first code. We are not assigning first diabetes code. First code is the post procedural hypoinsulinemia. Post procedural, after operation, hypo less, insulinemia, insulin production. So post procedural hypoinsulinemia is the first code. Then E13. Okay. And Z is 90.41. Three codes here you have to code. Similar way, secondary diabetes because of a drug, we have a E09 series code. Let me just show you this. See, diabetes, a complication with ketoacidosis, with kidney complication, with ophthalmic complication, neurological complication, circulatory complication, other specified complication, unspecified complications. Right? So we have less guidelines here. Then obviously for the later part of a guideline, you can see the tabular list, right? Like E11.22. Why I have to code N18 series again? If I'm coding E11.22, because E11 this 22 this CKD, diabetes with CKD. If I'm coding diabetes with CKD, then definitely it will ask me what is the stage of a CKD, which is coming under use additional code. Tell me this one. Then we are done with this diabetes also. Just answer.
D.
Okay.
D.
Type 1 or type 2? Achha, how do you know this is type 2?
It's type 2
Even?
and they're giving insulin.
Insulin, yeah. And it is under control also. With the medicine.
Diabetic patient of a complication, experimental focus, medical history, control with the lentils, diet and exercise. Patient will continue. So here they did not document the type of a insulin, right? So if what is our guideline? If the type of our insulin is not documented, then we have to code type 2. So E10 wala option cancel, B and C cancel. A and D we have, then we can code control with the Lantus. Lantus is a brand name of or name of a insulin. So that also you can include Z79.4. Okay. This one.
Option D cancel.
Option D cancel, okay. And
B is the answer.
B, okay. Okay, if it is a type 1, then definitely D is cancel. Very good. Now we have E10.621 in all three options. That is for your diabetic type 1 pressure ulcer. Sorry, not pressure ulcer. Diabetic type 1 ulcer. Okay, with foot ulcer. So,
A stands
to code only for this code. Do you have book, everyone? You can
Yes,
refer
sir.
You can go to E10.621.
It's type 1.
Diabetes with foot ulcer.
A is the answer.
Okay, what they are saying additionally?
You have to add answer.
Use
Height of
additional
the answer.
L97.4 to L97.5 series code. If it is not
Yes.
there, then you can come to 11.62. If it is not even 62, you can come to 11.6. Okay, somewhere it will be there. Correct. So you have to code additionally L97 series. Answer will be B. So it's not a chapter specific guideline. This is a what our practice, right? We have to go to the tabular list. We have to check, do I need to code additional code? Right?
The
That's what
answer
it-
would be B or A, sir.
A.
A, no? Okay.
Yes. You
You
have
said
to
answer will be B, that's why.
No. Okay, did I say that one? Oh, sorry. So because we have to code L97 series code. So this gestational diabetes, no, I'll tell you in a pregnancy chapter. 025.4 series is coming as the gestational diabetes. Okay, this other thing, other than that, diabetes, we don't have any guideline on the chapter number 4. All good? Anyone need little break? Please let me know, because we have one more chapter on this. And also it's very easy topic. And we can still go on, right? So please let me know if you want to do one big topic, which is very important, very important, or few small topic, which is okay, moderate important.
So big topic.
Big topic, okay.
So, big
We are-
topic, can we do tomorrow? Because I have a job.
Okay, you have class, no? Oh,
Yeah.
you have a office. Okay.
It's a big topic, we'll do it tomorrow.
So
Even-
first, someone said big topic, so I did not listen complete word. I think she was saying big topic we'll do tomorrow. Okay, so big topic was chapter number 9, which is very important. So definitely, yes, we can do tomorrow then. Okay, because it will need at least half an hour to complete that topic. Okay, fine then. Vinita, you can leave this one.
Okay,
Achha,
sir.
you have your 2 o'clock shift, right?
Yes, sir.
So after this one, so this is the chapter number 9, which we have hypertension and every other many different guidelines. So tomorrow we'll do chapter number 9 and chapter number 15. That is very important 2 topics. Okay, so let's do it. Some small topic, which is interesting, but not that much important, and it's very straightforward. Okay, so let's come to ERI. Or if you want, I can go with the mental disorders also.
I'll take leave, sir.
Sure.
Thank you, sir.
Mental disorder. You know that F series code. Anyhow, you read this in nursing. Okay, so mental or behavioral and neurodevelopment disorder is coming under F series code. Okay. In that, first we have pain disorder related to psychological factors. Okay, anyone need break? No, na? Okay. So pain disorder related to psychological factors, we have F45.41 code, which is for pain that is exclusively related to psychological disorder. It means patient have some psychological disorder. Because of that, patient is feeling that patient have a pain. Okay. Patient have psychological disorder which is related with a pain. Okay. Similar way, we have F45.42, pain disorder with related psychological factor. Means patient have a pain and related psychological factors. It's very similar kind of a things. Okay. In the F45.41, pain that is exclusively related to psychological disorder. It means patient have psychological disorder. Some people, they feel they have some mental disorder and they will feel that I have a pain on the leg, I have a pain on the leg, although they may not have that or not. But because of a psychological disorder they are feeling, they have a pain on the leg. That is F45.41. F45.42 is a pain disorder related with the psychological factor. Patient have a psychological problem. Patient have a pain, and both are related with each other. In 41, it's not mandatory that patient have a pain. Okay, but he's feeling that a patient is feeling that or just assuming that patient they have pain. So what is the guideline here that if G80.89, G89 is a pain code. Okay, so you cannot code G89 code along with F45.41 because this is coming under exclude 1. Now, first class, exclude 1. We cannot code 2 code, right? We have to code only 1 code. Exclude 1 means only 1 code, right? And that's why I told you that patient may not have a pain on this. And that is why we cannot code pain code separate, G89 series code. But with 42, patient have a psychological factor, patient have a pain. In that, we can code G89 series code also, which is specifying what is a pain, what is the specificity of a pain. That is the one guideline here. In remission, what we have seen in where we have seen chapter number 2, right? Similar way, here also we have an in remission code with related to the F10 to F19 series code. Okay, what we need to remember here that if the doctor in a question it is documented in remission, code in remission. If question does not say in remission, don't code. Simple, one line answer. Do not interpret it. Okay, you should not interpret it. If it is given in remission, code in remission. If it is not given, don't code it. See, requires provider clinical judgment and are assigned only on the basis of a provider documentation. Okay. This is very interesting now. Use, abuse, and dependence. Okay, you know what is the use, abuse, and here only we have use, abuse, and dependence. Do you know what is the meaning of that? Anyone?
Abuse is using it beyond it is necessary.
Very good. And dependence is a
Addict. They are addicted.
Very good, very good. See, I was not getting proper sleep. So now once in a while I took up a sleeping pill. Just example, okay? It's illegal actually, but it's a drug. I cannot buy that drug in a medical store directly. Suppose, okay, I'm using very rarely. Whenever I feel that I don't have yeah, Shalu, you raised your hand. Okay, nothing. Okay. So, suppose I take a sleeping pill once in a while. That is my use. Abuse, I am taking repeatedly. Okay, whenever I feel little anxious, I feel I cannot sleep, I will take up sleeping pill. That is abuse. I'm abusing that one. Dependence means without that I cannot sleep even. Every night I need. I am dependent on that. That is dependence. Similar way about the drugs. Drugs मतलब ये वाला that drugs, okay? Narcotic drugs. Alcohol, best example. A patient is consuming alcohol very rarely. He is a party animal, means social drinker. Whenever there will be a party, he will drink. That's all. That too in a limit. Use of alcohol. Abuse of alcohol. Every weekend he has to drink. Abuse of alcohol. Okay. But weekdays, sober. But Saturday, Sunday, full tully. That is abuse. Dependence every day. Every evening, he will be found there only. Dependence. Okay. So we have a different definition for use, abuse, and dependence clinically. Okay, but for just easy to understand, this is a concept you can refer. So which is more dangerous, use, abuse, or dependence?
Abuse and dependence, sir. Both.
Out of three, which is most dangerous?
Dependence.
Dependence. Very good. Out of use and abuse, what is more dangerous?
Abuse.
Abuse. That is your guideline. See how easy it is. Read this 4 bullet points.
Sir, what is remission, sir? Actually,
I'll come on that remission. Remission, same what we have seen in a cancer, coming back. Patient was addictive, dependence of alcohol. But then he went to rehab. He he is now well, but it is again he's starting
okay.
remission. So if both use and abuse documented, code only abuse. Abuse dependence both documented, code dependence. Use abuse dependence, that dependence use and dependence only. Okay. Psychoactive substance use. So there you will get all the F10 series, 10, 11, 12, 13, 14, 15, 16, 18, 19 series is for some drugs only. Okay. This is not a guideline, just we have a code, evidence of a alcohol involvement in a blood test. Dementia, here also we don't have a guideline, just that last year also they have elaborated this dementia code, and this year also they have introduced new codes. These are coming under new codes only. So there is no guideline. Done. F series guideline done. Use, abuse, dependence. That's all. Any doubt on this? Prosperity does not have any guideline. Ulcer. Chalo, let's go with the L series code. Last topic, okay? Chapter number 12. Skin and subcutaneous tissue. And now I change it in a... Which color you like? Blue? Okay. Pressure ulcer, non-pressure ulcer. Ulcer, you know, degradation of skin in a deeper level. Okay. So it may be two types. Okay. Pressure ulcer and non-pressure ulcer. Pressure ulcer is because of a pressure applying on the skin for the long period of a time. When the patient have a bedridden or paralyzed people, okay, bed dependent people, they are always lying down on a bed, right? So some pressure will be applied on the skin, mostly on the thighs, calf, ankle, buttock, side, neck, shoulder. Okay, these part are more susceptible for a pressure ulcer. That is a pressure ulcer. Non-pressure ulcer because of some disease, diabetes, the most important. If patient have a diabetes and patient have a pressure ulcer, do not combine, okay? Because pressure ulcer etiology is already given here. Etiology means reason, right? So etiology has given as a pressure. So you cannot combine, you cannot say this ulcer is because of diabetes. No. But if it is a non-pressure ulcer and patient have a diabetes, you can code E11.621. Remember foot ulcer code E11.621, which need L97.4 to L97.5 series. That one. Okay. So here we will talk about the pressure ulcer stages. We have a different stage of a pressure ulcer. See. So what we have a guideline. Code category L89 pressure ulcer identifies site and stage. In this category of a code, it will be described, it will be two things, site as well as a stage. Okay. Stage oh, so sorry. I don't have any code. One second. Let that download. So what we have to do here? So classify pressure ulcer stage on the based on the severity, okay, which designated by stage 1 to 4, and deep tissue pressure injury unspecified. We have stage 1, stage 2, stage 3, stage 4. Then we have a deep tissue pressure injury, and then we have unspecified and unstageable. So what is the meaning of unstageable? Unspecified means I understand. The doctor has not specified what is the stage, whether it's a stage 1 or stage 2, stage 3, stage 4, or deep tissue. Okay, they did not specify means unspecified stage. Agree? Everyone?
Yes, sir.
Yeah, I feel that. Okay. Okay. So, what is unstageable? Unstageable means doctor is trying to find out what is the stage, but maybe patient have some grafting, patient have some bandage, patient have some skin, the dead skin on the upper layer of a ulcer. So he is trying, but he could not find out. Okay, that time it will be considered as unstageable, cannot be clinically determined. The ulcer is covered with the scar or has been treated with the skin or muscle graft. Because of this reason, if doctor could not determine the stage, then it will be considered as a unstageable. I'll show. See here. Pressure ulcer on the right elbow. Okay. L 89.010. Unstageable is a 010. Stage 1 is a 011. Stage 2 is a 012. Stage 3 013. Stage 4 014. Stage 016 is a deep tissue damage, and 019 is a unspecified stage. How easy it is, right? If the last character is 1, it's the first stage. Last character is 2, second stage. Last character is 3, third stage. Last character is 4, fourth stage. Last character is 6, deep tissue damage. Last character is 9, unspecified stage. And last character is 0, is a unstageable pressure ulcer. Done. And if it is a laterality, I'll give you one more trick. If it is a laterality, okay, then the fifth character will be 1. Here you can see 1 is for right side. If you will come to L90, L89.02, it would be left elbow. Pakka. See this. So whenever there's a difference in the laterality, 1 is always right, 2 is left, 3 is a bilateral. Okay. So the last character will be 0 here.
So this laterality code, whatever you said, that 1, 2, and 3 now, it is for all the chapters or only for
All
this
the
chapter?
chapters. All the chapters.
Okay.
Yeah, someone else asked.
Sir, how to differentiate unstageable and unspecified?
They will give you. In a question, they will give you. But that was not same. You need to understand the concept. What is unstageable? You will not decide. That doctor will decide whether it's unspecified or unstaged. If I say a patient have a left elbow, right elbow pressure ulcer, that's all. My question is saying a patient have a right elbow pressure ulcer. Did I say any stages?
No.
Did I say that is unstageable? I tried, I did not find. No. You will quote unspecified stage. L89.012. Okay, unspecified stage. If I say patient have a right elbow pressure ulcer, I tried to find out the stage, but there was a grafting. Because of that, I could not find. Now what you will quote? 019 or 010?
010.
010. I said, I tried to find out the stage, but I could not able to do that one because of some XYZ reason. So you will code unstageable. That is the only concept here. Where it gone then? See how I'll find out the stage? You will not. Should be guided by a clinical documentation, right? I am no one to decide. That will be clinically documented. Healed pressure ulcer, no code. It's already healed. No history code. Healing pressure ulcer, yes, you can code. Should be assigned as an appropriate stage. If the ulcer was documented at the time of admission, but healed at the time of a discharge, what you will code? You will code stage, right? Patient admitted because of ulcer. He is going to discharge because it was healed. Code in the discharge summary, you have to code ulcer code. Now, sixth one is very interesting one. Admitted with the pressure ulcer evolving into other stage during the admission. Suppose patient admitted for 5 days, Monday to Friday. In the first day, stage was a 3. Okay. And second day, also in the last day, Friday, the patient is admitted in the inpatient pressure service 1 stage and progress to the higher stage. Suppose patient is admitted on the stage 2, but on the last day, it was stage 4. What we need to code? Here we have to code 2 separate codes. One code, site and stage on the ulcer at the admission time, and the second one is the highest stage. I'll give you one more example. First day, Monday patient admitted, it was a stage 2. Okay. Tuesday, it was stage 4. And by Friday, it is stage 1. 2, 4, 1. What you will code here? On a Friday, what you will code?
2.
You will code 2 code. First, at the time of admission, it was stage 2.
2.
Then,
And then
on the Tuesday, it was stage 4.
4.
You will not code what is stage 1 in a Friday. Although that day is a stage 1. But still you will code stage 2 and stage 4 as per the guideline.
Guidelines.
Right?
Sir, please explain it once, sir.
Okay. Let me check if I have that one. If I not have, then I have to write it. Okay, I don't have. Fine. Let's see. Okay. Pressure. Okay. Monday, patient have stage 2. Tuesday, it was stage 4. And on Friday, discharge day, it was stage 1. My question is what we are going on a Friday. So we will code on Friday also. You will code 2 code. Stage 2 and stage 4. Why not stage 1? Because as per my guideline, it is saying point number 6, if patient is admitted to an inpatient hospital with a pressure ulcer at 1 stage and it progresses to higher stage, 2 separate codes should be assigned. One code for the site and stage of the ulcer and the admission. The second one, second one is for same ulcer site and higher stage reported during the stage. Okay. Now my question is, suppose this is question 1. Okay. Question number 1. Now second question is, Monday patient have stage 2, Tuesday stage 1, and Friday also stage 1. What I'm going to code here? Code only one code here. Code stage 1. Why so? Because my guidelines saying I have to code at the time of admission wala code and the highest code. Here nothing is highest than 2. If it is 2 also, same 2. If it is 3, I have to code 2 and 3. Right? But in the second scenario, I have to code only stage 2, not stage 1. So sorry. Stage 2. The time of admission.
We have to code only on admission days code.
Correct. Because here I don't have a higher stage code than 2. See? Second code for the same ulcer site and the highest stage. What is the highest stage here? 2 only. So I'll code 2. Correct? Chalo. Stage one more. Na? Monday, stage 2. Tuesday, stage 3. Friday, Wednesday, stage 4. Thursday, stage 3. Friday, stage 2. What you will code here?
Stage 2 and
Stage 2 and stage 4.
Yes, stage 2 and stage 4. Why not 3? Because 3 is not a highest stage here. We have a highest stage on the Wednesday. Right? So I will code first code for at the time of admission, second code which is for the highest stage. Now clear? Yes, no? If you
Yes,
read
sir.
it. Same guideline we have for non-pressure chronic ulcer also. Same guideline. Healed, no code. Healing, assigned code. Okay. Progress to the another level. Again, 2 separate code. And the clear is the highest stage. See, same guideline we have. Done. Good. Any doubt? Any doubt? Okay, any doubt, guys? Today's class. We have completed chapter number 2. Okay, chapter 4, chapter 5, and chapter 12. Tomorrow, chapter 9, chapter 15. And then I don't think so. We have some other things also. If we could complete these 2 chapters in 2 hours, then 1 more hour I'll take and I will finish ICD. And that is quite possible. We can do it. Okay, any doubt? Only one girl